Hi everyone, it's Dr. Jeff here. Today we're talking a little bit about colic and colicky babies. Colic is a condition where babies will cry a lot. And coming out of Denmark, in Denmark actually kids actually get covered by chiropractic care up to the age of about 18. So there's lots of research coming out about chiropractic care in kids out of Denmark. And actually they do find that in the research there that kids in Denmark actually have less incidence of colic, of scoliosis, of SIDS, a number of other things that we take for granted here. But with colicky babies, they classify a colicky baby as a baby that cries more than 10 to 12 hours a day. And that's a lot of crying. Now, what do chiropractors do about it? Well, if you've ever seen a baby being born, when the head comes out, they tilt the head to the side, they try and pull the baby out to get that shoulder out, and that can really affect the upper vertebrae in the neck. The thing that happens is when the baby is in the womb for 9 months, it's all curled up, and they try and actually bring the baby out and they stretch it on a table to see how long it is, and that can actually screw things up in the middle of the back. And what we're dealing with is we're dealing with two parts of the nervous system called the autonomic system. Well, one is called the parasympathetic system, and that's actually the system that actually turns the stomach on, and we have the sympathetic system which actually turns the stomach off. So when we're talking about the sympathetic and the parasympathetic systems here, the parasympathetic system is a green one here. Actually, most of that comes out of your neck as the vagus nerve, and it comes down and innervates the stomach. The sympathetic system is more the yellow. What can happen is if something's wrong with the neck, that parasympathetic system will be blocked off a little bit, and what will happen is the stomach cannot turn itself on to digestive food. So these are babies that are usually, after they're eating, they can't really get the stomach to turn on, so they're actually quite fussy. Whereas there's something coming in the middle of the back here between the shoulder blades that actually the sympathetic system, that turns the stomach off. So what happens with that is that there's always acid being in their stomach. So these are babies that are going to be fussy before they eat. When they eat, they might get a little bit better because that acid is being soaked up, but that stomach can't be turned off, so it's always secreting acid. So that's what happens with the autonomic system and colicky babies. Well, as a chiropractor in treating colicky babies, generally they don't really have the same muscular structures as males or as we do, as adults do. So it's just a light pushing and realigning the vertebrae. There's no popping or cracking that goes on. Generally you'll find kids react really well to adjustments. And we have found in our office here with the colicky babies is we can usually, and this is research that shows us as well, is we can take a colicky baby that's crying 10 to 12 hours a day, and we can actually reduce that to about 4 or 5 hours a day within 1 or 2 treatments. And usually after 4 or 5 treatments, we can actually get them back to being as normal as a normal baby can be. If you have any questions about colicky babies or chiropractic care, you can always reach me at jgoldsworthy at goldsworthywellness.com. If you like the video, share with your friends. I'm Dr. Jeff, and I've got your back.